Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Abnormal semen analysis. If there is no semen, then it is called as aspermia. If the sperm concentration is less than 15 million per ml, then it is oligospermia. If the sperm concentration is less than 5 million per ml, if the sperm concentration is less than 15 million per ml, then it is called as oligospermia. If the sperm concentration is less than 5 million per ml, then it is severe oligospermia. If the sperm is non-motile or the motility of the sperm decreases, then it is asthenospermia. If the sperm has abnormal morphology, then it is teratospermia. If it is a non-viable or dead sperm, then it is necrozoospermia. If there are no sperms in the semen, then it is azoospermia. If there is increased WBC in the semen, then it is leukocytospermia.
No sperm in the semen, then it is azoospermia.
thank you and thank you for watching.